Brad Hazzard is a Liberal minister, but he's not shy about calling out his Commonwealth colleagues, warning the healthcare system is failing.
I think it's time for the federal government to be looking very seriously at reform of Medicare. State governments just can't go on taking this burden through our hospitals.
He blames out-of-pocket costs, up to $100 for GPs and $500 for specialists, for increasingly driving patients to emergency departments for basic complaints. What's more, he says just 7% of new medical graduates are choosing to become GPs because of low Medicare rebates.
Does that tell us the system's working? I think the average person would say, no, it's not working.
The call for reform is backed by Queensland Health Minister Stephen Miles, who wants to see rebates increased for treating chronic illnesses like obesity.
We're seeing very significant increases in the number of Queenslanders seeking help at our hospitals.
Victorian Health Minister Jenny Mikakos is also on board, saying this is something that needs to be addressed by the federal government. In a statement, the Federal Health Minister Greg Hunt said,
"The government is already reforming Medicare. The MBS Review Task Force is reviewing items to ensure they best represent current best clinical practice and support high-quality services for patients."
The then federal Labor government introduced the Medicare freeze back in 2013, and it was reintroduced by the coalition government the following year. Since 2017, there's been a phased unlifting of the freeze, but the New South Wales Health Minister says this clearly hasn't gone far enough. Caroline Marcus, Sky News, Sydney.